I was inspired to become an ENT specialist because it's a specialty that encompasses many different areas. Operating on the ear is different than operating on the nose, which is different than operating on the throat.
I first became interested in the field of ENT when I was in medical school. That's when I began to learn more and more about the type of an impact that an ENT specialist can have on a patient.
So I've always enjoyed building things and working with my hands, so I knew pretty early on in my medical training that I wanted to be a surgeon. And then that first year of medical school, when we're kind of learning about the different parts of the body, I really enjoyed head and neck anatomy and anatomy involving the ear, nose, and throat. And so I thought this would, ENT would be a good fit.
What inspired me to become an ear, nose, and throat provider was that initially when I was at PA school, I followed another PA who did otolaryngology. And then I went on to do a rotation with a MD who did ear, nose, and throats. And I really fell in love with it at that point. I really like how hands-on it is.
What inspired me to become an ENT provider was a Craigslist ad back in 2008. It was my first job opening to get into Austin. Took it, fell in love with ear, nose, and throat, mostly ears, and could never get away from it.
Visit the experts at Capital ENT and Sinus Center to breathe better now.